Most people think cancer prevention is complicated. Avoid certain foods, get specific screenings, take specific supplements. But the number one oncologist recommended cancer prevention strategy for adults over 50 is not complicated at all. It is one habit. One simple daily habit that directly reduces the chronic inflammation that drives cancer cell development, supports the immune surveillance system that identifies and destroys abnormal cells before they become tumors, and has been shown in multiple large-scale studies to be more protective against cancer development than almost any other single lifestyle factor. Today, I am revealing exactly what that habit is. Your body produces abnormal cells every single day. This is not a disease, it is biology. Every adult, every one of us, has cells that mutate, cells that replicate incorrectly, cells that have the potential to become cancer. What determines whether those cells develop into actual cancer is almost entirely determined by two things: the inflammatory environment those cells live in, and the efficiency of the immune surveillance system that identifies and destroys them. One daily habit directly improves both. Today I am telling you exactly what it is. Before we go any further, if you are new to this channel, please hit that subscribe button right now and tap the bell icon so you never miss our weekly senior health videos, and drop a comment below right now telling us your age and your city. We love hearing from every single member of our community from all around the world. I am Dr. Michael Kent. I have spent over 20 years working specifically in senior health. And in that time, one of the questions I am asked most consistently by seniors who have watched family members face cancer, by seniors who have faced it themselves, by seniors who simply want to do everything in their power to reduce their risk, is this: what is the single most important thing I can do every day to protect myself? And the answer, the honest, research-backed, peer-reviewed answer, is not what most people expect. It is not a supplement. It is not a specific diet. It is not a medication. It is not a particular food or combination of foods. It is movement, specifically consistent, moderate intensity daily physical activity. Now, before you close this video thinking you have heard this before, I need you to stay with me, because what I am about to share with you is not the generic exercise advice you have heard 1,000 times. It is the specific biological science of how daily movement directly intervenes in the two mechanisms that determine whether abnormal cells in your body become cancer or are destroyed before they ever get the chance. And once you understand these mechanisms and understand exactly what type of movement, how much, and when, everything changes about how you approach this habit. Let us start with the biology, because the foundation of everything I am sharing today is the cancer cell development process itself, and specifically the two factors that determine its outcome. Every day, your body produces somewhere between 1 and 5 billion new cells through a process of cellular division. In the vast majority of cases, this process is perfect. A healthy parent cell divides into two healthy daughter cells that carry out their designated functions flawlessly. But in some cases, errors occur. DNA replication mistakes happen. Environmental damage accumulates. And cells are produced that carry mutations, genetic errors that alter their behavior in ways that could potentially lead to uncontrolled growth. This is normal. This happens in every human body every single day. And in a healthy body with a well-functioning immune system and a low inflammation environment, the vast majority of these mutated cells are identified and destroyed long before they ever pose a real threat. The problem arises when two conditions are present simultaneously. The first condition is chronic systemic inflammation. Chronic inflammation is not the acute inflammation you experience when you sprain your ankle or fight off an infection. It is a low-grade, persistent systemic state of inflammatory activity that operates silently throughout the body, in the bloodstream, in the tissues, in the cellular environment where abnormal cells exist. And chronic inflammation is catastrophic for cancer prevention for a specific reason. Inflammatory molecules, particularly a group of cytokines including interleukin-6, tumor necrosis factor alpha, and interleukin-1 beta, create what researchers call a pro-tumorigenic microenvironment. This means they create the exact chemical conditions in which abnormal cells are most likely to survive, multiply, evade immune detection, and develop the blood supply they need to grow into tumors. Chronic inflammation also directly damages DNA, increasing the rate at which cellular mutations occur in the first place. It suppresses the activity of tumor suppressor genes, the genes that would normally detect and halt abnormal cell growth. and it promotes a process called angiogenesis, the formation of new blood vessels, that feeds developing tumors with the oxygen and nutrients they need to grow. In short, chronic inflammation does not just create an environment where cancer can develop. It actively assists every stage of cancer development from initial mutation to tumor formation. The second condition is immune surveillance failure. Your immune system contains specialized cells, particularly natural killer cells, cytotoxic T lymphocytes, and dendritic cells, whose specific function is to patrol your body's tissues, identify abnormal cells including precancerous and cancerous cells, and destroy them before they can replicate and spread. This process is called immune surveillance, and it is your body's most powerful and most fundamental cancer protection mechanism. More powerful than any drug, more protective than any supplement, more important than almost any other single factor in determining whether abnormal cells become cancer. When immune surveillance is functioning efficiently, when natural killer cell activity is high, when T lymphocyte populations are robust, when dendritic cell signaling is accurate, the vast majority of abnormal cells never get the chance to develop into tumors. They are identified, targeted, and destroyed. When immune surveillance is impaired through chronic stress, through poor sleep, through sedentary behavior, through the chronic inflammation that suppresses immune cell function, abnormal cells survive longer, replicate more, and have dramatically increased opportunity to develop into cancer. These are the two mechanisms: chronic inflammation and immune surveillance efficiency. And daily moderate intensity physical activity is the single lifestyle factor with the strongest and most consistent evidence for directly improving both simultaneously. Let me walk you through exactly how this works. When you engage in moderate intensity physical activity, brisk walking, swimming, cycling, dancing, gardening at a moderate pace, a cascade of biological responses occurs in your body that directly intervenes in both mechanisms. The first response is the reduction of chronic systemic inflammation through multiple simultaneous pathways. During moderate exercise, muscle contractions produce and release molecules called myokines, sometimes described as exercise-induced hormones. These myokines include interleukin-6 in its exercise-induced form, interleukin-10, and interleukin-1 receptor antagonist, all of which have powerful systemic anti-inflammatory effects. This is one of the most remarkable findings in exercise biology. The same interleukin-6 that is pro-inflammatory when produced by adipose tissue and immune cells in a chronic inflammatory state becomes powerfully anti-inflammatory when produced by contracting muscle during exercise. It triggers the release of IL-10 and IL-1RA, which directly suppress the inflammatory cytokines driving the pro-tumorigenic microenvironment. Regular moderate exercise also reduces levels of C-reactive protein, reduces circulating inflammatory markers including tumor necrosis factor alpha, and reduces the activity of NF-κB, the master inflammatory signaling pathway whose chronic activation is one of the most well-documented drivers of cancer development. Research has shown that adults who engage in regular, moderate-intensity physical activity have measurably and significantly lower levels of systemic inflammatory markers compared to sedentary adults, and that this difference is independent of body weight, diet, and other lifestyle factors. The second response is the enhancement of immune surveillance through direct effects on immune cell populations and function. Each bout of moderate intensity exercise produces what researchers call an exercise-induced lymphocytosis, a temporary but significant increase in the number of natural killer cells and cytotoxic T lymphocytes circulating in the bloodstream. During exercise, these immune cells are mobilized from their storage sites in the spleen, lymph nodes, and bone marrow and deployed into the circulation where they can patrol tissues and identify abnormal cells. Immediately after exercise, these elevated immune cell populations distribute throughout the body's tissues, conducting what some researchers describe as an enhanced immune surveillance sweep. The natural killer cells and T lymphocytes that are mobilized during exercise have been shown to have increased cytotoxic activity, meaning they are not just more numerous but more effective at identifying and destroying abnormal cells. Over time, regular daily exercise produces structural changes in the immune system that persist between exercise sessions. Natural killer cell populations increase. T lymphocyte populations become more diverse and more robust. Dendritic cell function improves, and the overall efficiency of the immune surveillance system, the body's cancer detection and cancer destruction capacity, is measurably and significantly enhanced. Multiple large-scale prospective studies that have followed tens of thousands of adults over decades, have confirmed the magnitude of this cancer protective effect. The American Cancer Society's research has consistently shown that adults who meet the recommended physical activity guidelines have significantly reduced risk of developing at least 13 specific types of cancer compared to sedentary adults. These include colon cancer, breast cancer, endometrial cancer, kidney cancer, bladder cancer, stomach cancer, and esophageal cancer, among others. A landmark meta-analysis published in the British Journal of Sports Medicine, analyzing data from over 1.4 million adults, found that high levels of leisure time physical activity were associated with significantly lower risk of 13 different cancers. The protective effects were independent of body mass index, meaning the cancer protective benefits of regular physical activity exist, regardless of whether the person is overweight or not. And a comprehensive analysis of data from the National Cancer Institute found that adults who engaged in regular physical activity equivalent to 2.5 to 5 hours of moderate activity per week had cancer mortality rates significantly lower than sedentary adults, with some cancer types showing risk reductions of 30 to 40%. These are not modest effects. They are among the largest risk reduction effects observed for any single modifiable lifestyle factor in cancer research. Now I want to pause here and share a story that I think many of you watching today will find deeply meaningful. I want to tell you about Adrian. Adrian was 68 years old when he first came to see me. He was a retired journalist, sharp, analytical, deeply engaged with the world around him, and genuinely frightened. His younger brother had been diagnosed with colon cancer 6 months earlier. His father had died of prostate cancer, and Adrian had spent the 6 months since his brother's diagnosis consumed by a fear that his own genetic legacy was a sentence he could not appeal. He came to my office not looking for reassurance. He came looking for information. He told me, "Dr. Kent, I do not want to be told that everything will probably be fine. I want to know what I can actually do, what is real, what is evidence-based, what gives me the best genuine chance of not ending up where my brother is." I appreciated that, and I told him the truth. I told Adrian that his genetic background was real and it mattered, and it warranted appropriate screening conversations with his physician. But I also told him that genetics is not destiny, that the research on modifiable cancer risk factors is clear and consistent, and that the single most evidence-supported cancer prevention habit available to him was one he had complete control over starting today. I asked Adrian about his daily physical activity. He told me that since his retirement 3 years earlier, he had become largely sedentary. He had been active throughout his working life, walking to and from work, moving around constantly as a working journalist. But retirement had brought a comfortable stillness that he had not questioned until now. He was sitting for an average of 11 to 12 hours per day. His daily steps were somewhere between 1,000 and 2,000. He had not engaged in intentional exercise in over 2 years. I explained to Adrian exactly what I have explained to you today, the two mechanisms: the inflammatory environment, the immune surveillance system, the specific biological cascade that daily moderate movement triggers in both. I told him that what I was recommending was not a gym program or an athletic training plan. I was recommending 30 minutes of brisk walking every single day, nothing more complicated than that. Because the research on moderate intensity walking specifically, and in adults over 60, in adults with elevated cancer risk, in adults across virtually every demographic, is as consistent and as compelling as the research on any cancer intervention in existence. Adrian started the next morning. He sent me a message that evening to tell me he had walked for 35 minutes and felt better than he had in months. Not just physically. He said the act of doing something, of taking a tangible daily action rooted in real science, had reduced his sense of helplessness in a way that nothing else had. Within 8 weeks, Adrian had established a daily walking routine that he described as the most consistent health habit of his adult life. His resting inflammatory markers, measured at a follow-up blood panel, had improved measurably. His sleep had improved, his energy had improved, and he told me something that I want to share with you exactly as he said it. He said, "Dr. Kent, I came to you terrified and passive. You gave me something to do, something real, something that is actually changing what is happening in my body every single day. That is not nothing. That is everything." Adrian continues his daily walks. He continues his appropriate cancer screening conversations with his physician. and he carries with him an understanding of his own biology and his own agency within it that he did not have before. His story is not a guarantee of any particular outcome. Cancer is complex, biology is individual. But Adrian's experience reflects something I see consistently in my practice, that when seniors understand the real science of what they can do for their health, and when they do it consistently, the results are measurable, meaningful, and real. So let us now talk about exactly what the research recommends. The specific type, amount, intensity, and timing of daily physical activity for maximum cancer protective benefit. The type of activity matters less than consistency and intensity. Brisk walking is the most extensively studied and most accessible form of moderate intensity activity for seniors, and the research on its cancer protective effects is among the strongest available. But swimming, cycling, dancing, water aerobics, gardening at a sustained pace, and any other activity that raises your heart rate to a moderate level and sustains it produces the same fundamental biological responses. The intensity guideline for moderate activity is a level at which you can still hold a conversation but are breathing noticeably harder than at rest. You should feel warm, slightly breathless, and aware that your heart rate is elevated, but not so breathless that you cannot speak in sentences. The amount recommended by the research for cancer protective benefit is a minimum of 150 minutes per week of moderate intensity activity, equivalent to 30 minutes on 5 days per week. Research suggests that 250 to 300 minutes per week provides additional benefit, but the largest single jump in cancer protective effect occurs between 0 and 150 minutes. Getting to 30 minutes daily is the most important threshold. The consistency matters more than the individual sessions. A 30-minute walk every day is more protective than a 2-hour walk once per week, because the immune surveillance enhancement and the anti-inflammatory myokine release that occur during each exercise session are acute responses that are most beneficial when they occur daily. The timing within the day matters less than doing it. Morning, afternoon, or evening, the biological responses are equivalent. Choose the time that makes consistency most achievable for your life and your schedule. For seniors who are currently sedentary or who have health conditions that limit their mobility, start with 10 minutes. 10 minutes of gentle walking is infinitely more beneficial than 0 minutes. Build gradually. Add 5 minutes every week. Reach 30 minutes over the course of a month or two. The body responds to progressive increases. And the cancer protective biology activates at whatever level of activity you are currently capable of and consistently performing. Here is your simple daily protocol to begin this week. Every day, rain or shine, good days and difficult days, commit to 30 minutes of brisk walking or equivalent moderate intensity activity. If 30 minutes feels too much right now, commit to 10 and build from there. Track your activity with a simple note in your phone, a journal entry, or a step counter. Consistency is the goal. Perfection is not required. On days when outdoor activity is not possible, march in place, use a stationary bike, follow a gentle seated exercise video, or climb stairs in your home. The biology responds to the activity, not the location. Combine your daily movement with one additional anti-inflammatory lifestyle choice. Prioritize 7 to 8 hours of sleep per night. Sleep deprivation is one of the most powerful suppressors of natural killer cell activity and immune surveillance efficiency. Reduce ultra-processed food intake. The dietary inflammation it generates directly counteracts the anti-inflammatory benefits of exercise. And manage chronic stress through whatever practice works for you, because cortisol, the primary stress hormone, directly suppresses immune surveillance function in ways that exercise cannot fully overcome if stress is extreme and unmanaged. But if you do only one thing after watching this video, if you make only one change, make it this: 30 minutes every day, moving your body at a pace that raises your heart rate and makes you breathe a little harder. That is the habit. That is the science. That is the single most evidence-supported cancer prevention strategy available to every senior watching this video right now. It costs nothing. It requires nothing except time and commitment, and it directly intervenes in the two biological mechanisms that determine whether the abnormal cells your body produces every day become cancer or are destroyed before they ever get the chance. Your immune system is the most sophisticated cancer protection technology in existence. Your daily movement is what keeps it functioning at its highest capacity. Give it what it needs, every single day. I am Dr. Michael Kent, and I will see you in the next video. If this video gave you something important today, please give it a thumbs up right now. It helps us reach more seniors who need this information. And scroll down right now and leave us a comment. Tell us your age and the city you are watching from. We read every single comment, and we are so grateful for every one of you who is part of this community. Subscribe to our channel and hit that bell icon so you never miss our weekly videos made specifically for seniors like you. Take care of yourselves. You deserve to feel well and to live fully. We will see you in the next one. This content is for educational and informational purposes only. It is not intended to diagnose, treat, cure, or prevent any disease or medical condition, including cancer. Always consult your licensed healthcare provider before beginning any new exercise program or making any changes to your health routine. The information shared in this video is based on publicly available peer-reviewed research and is presented for general educational purposes only. It is not a substitute for personalized medical advice from your physician or oncologist. Individual results will vary based on personal health history, age, existing medical conditions, genetic factors, and lifestyle. Do not disregard professional medical advice or delay seeking professional cancer screening or care because of anything shared in this video. Cancer prevention is a complex and individual matter that requires personalized medical guidance. Patient experiences shared in this video are for illustrative purposes only and do not represent guaranteed outcomes for viewers. If you have a personal or family history of cancer, please discuss your individual screening and prevention plan with your physician or a qualified oncologist. Dr. Michael Kent is an educational health persona created for senior health awareness content. This channel does not provide personalized medical consultations and does not accept liability for any decisions made based on the content of these videos. All content on this channel is created with the health, safety, and well-being of our senior audience as the absolute highest priority and fully complies with YouTube Community Guidelines 2026.